The Demographic and Health Surveys, DHSs, are nationally and subnationally representative household surveys. I start this lecture by summarizing the study design of a typical DHS, then back up and explain each study design concept in more detail by looking at an example DHS. Usually, DHSs are representative at the provincial level, but increasingly, surveys are representative at a district level in countries where health system decisions are made at the district level. For example, in Rwanda and Malawi. DHSs are cross-sectional and repeated approximately every 5 years in low and middle-income countries. This means that entirely unique sets of villages and neighborhoods are sampled each time a DHS is conducted. Complex sampling methods are used. Urban areas, for example, often comprise a small portion of the overall population in low-income countries, but are oversampled in a DHS to ensure that there is sufficient sample size to make urban population estimates. In a typical DHS, 6,000 to 30,000 households will be sampled across the country. In the selected households, all women aged 15 to 49 are invited to complete an interview. In many countries, a subsample of households also include male respondents aged 15 to 59. DHSs are implemented jointly by a country's National Institute of Statistics or similar government agency, with technical and financial support from ICF International under the U.S. Agency for International Development Project, Measure DHS. See measuredhs.com for more information. I just gave an overview of the DHS study design. Now let me review an example, the 2010 Rwanda DHS, with more explanation about each aspect of the study design. The first step is stratification. The Rwandan government decided to make estimates of demographic and health outcomes at the district level, since their health system administers care and implements policy by district. This means that the sample was stratified by district, or, in other words, an independent sample of households was drawn in each of the 30 districts. Within each district, all primary sampling units, or PSUs, are listed with their population size. Typically, PSUs are the enumeration areas of the last census. In the 2010 Rwanda DHS, villages were used as the PSUs, since the previous census was out of date at that time. Then a sample of PSUs are selected with probability proportionate to population size. Here I show a map of Karehe District. These are not actually village boundaries, they are sector boundaries, but I use the map to show how all PSUs are listed and then sampled in the first stage of sampling. The number of PSUs, or the size of the first stage sample, is often more important to the statistical power of the final sample than the total number of households or individuals sampled. I talk more about this in the lectures on survey analysis and data and summary statistics. The next step is to check how many PSUs were selected in urban versus rural areas across the national sample. Urban and rural populations tend to be different in terms of their demographic and health characteristics, so it's important to be able to summarize the national statistics in these two subpopulations. In low-income countries like Rwanda, the proportion of the national population living in urban areas is small, so the total urban sample might not provide a sufficient sample size to make urban estimates. Therefore, the survey implementers oversample in urban areas. Urban areas are shown on this map in orange. How exactly was oversampling performed in the Rwanda 2010 DHS? The implementers increased the number of sampled PSUs from 16 to 20 in each of the 3 districts that comprise the capital city, Kigali. Oversampling a subpopulation leads to unequal probability of selection, which is why it is important to use sampling weights when you analyze DHS data. People from Kigali are overrepresented in this sample. Sampling weights will be covered in greater detail later. Here is a map of all 492 PSUs that were included in the final 2010 Rwanda DHS, with urban neighborhoods displayed in orange and rural villages displayed in blue. After the final sample of PSUs were selected, the implementers sent listing or mapping teams to each of the 492 PSUs. These teams hand-sketched maps of each PSU, each map showing all households, main roads, and key landmarks in the village or neighborhood. In the second stage of sampling, these maps were brought back to the central office, where the survey planners selected which households would be included in the final sample. It is important that this step is done outside of the field context by someone not directly involved in the interviewing process, to prevent any conscious or subconscious bias. For example, selecting households that are easier to access or households that look more inviting to visit. Sampling households from the map is usually done systematically. For example, selecting a household in a corner of the map, counting 10 households, selecting another household, counting 10 households, selecting another household, and so on. After this point, the sample selection is done, and the interviewing team enters the field to implement the survey. DHS surveys are comprised of 3 questionnaires: Household Questionnaire, Women's Questionnaire, and Men's Questionnaire. These questionnaires are administered by an interviewer in the respondent's home, and the respondent's answers are recorded on paper by the interviewer. How many questions do you think are in a typical DHS? Depending on how you count, during a typical DHS interview, women respondents answer about 115 questions about their households and household members, and 352 questions about themselves and their children. A single interview can easily take 2 hours to complete. Men respondents are asked roughly 165 questions. Additional time is needed in many surveys to collect blood samples and measure the height and weight of respondents and their children. Is the DHS a quantitative or qualitative survey? The answer is DHSs only collect quantitative data. Quantitative data can be used to answer questions that start with the words when, how much, or how often, and the results can be generalized to the whole population. Qualitative data, on the other hand, can answer in-depth questions about how and why. However, the results from qualitative data collection are usually specific to the respondents interviewed and may be difficult to generalize to the population. DHS interviewers follow a specific protocol that guides them through hundreds of questions in a specific order and skip pattern. Although many questions are about sensitive topics and respondents may share deeply personal details from their lives, all data are coded according to predetermined response categories. For example, a question in the domestic violence module on the Women's Questionnaire asks, "Does your husband ever do any of the following things to you? Push you, shake you, or throw something at you? Slap you, twist your arm or pull your hair?" and so on. Although a respondent may describe an incident of domestic violence in her personal life, her response is recorded in a quantitative format with the value 1 equals yes and 2 equals no to each question. Here is a list of topics that are included in DHS surveys and the number of surveys ever conducted on each topic. The main focuses of the DHS are fertility and reproductive health and nutrition among women and children. Most surveys also collect data about HIV knowledge, behavior, and outcomes, tuberculosis, malaria, tobacco usage, and health insurance coverage. A small sample of men are included in most surveys now, and a subsample of women are often asked about domestic violence. Most surveys now also collect GPS coordinates from PSUs. Over 300 surveys in 90 countries have been conducted since 1984 when USAID launched the Measure DHS project. Initial surveys only included women respondents. From these interviews, 4 data files were created for each survey: women, kids, households, and household members. You will notice that the data are duplicated across these 4 files. For example, the kids recode file includes mother and household data. Due to cultural taboos against asking unmarried women about sex, many early surveys only included married women. Soon after, though, Measure DHS began interviewing all women aged 15 to 49 and included male respondents aged 15 to 59 in a subset of households, which resulted in a 5th men's data file. In 1996, DHS field staff began collecting latitude-longitude coordinates in PSUs. Coordinates were created for previous surveys going back to 1987 using a method called gazetteering. This resulted in a 6th dataset of PSU latitude and longitude coordinates. In 2001, Mali was the first country to implement HIV testing in a subsample of DHS respondents, resulting in a 7th dataset with HIV test results. In 2006, malaria and other blood tests were added to the DHS, but rather than choosing a subsample of respondents, the tests were administered on all respondents, and therefore the results are included in existing data files. Finally, in 2006, the World Health Organization provided new guidelines for estimating child malnutrition based on a new dataset of average height and weight measurements from a global sample of children. Starting in 2006, all new DHS surveys reported stunting, wasting, and underweight results according to the old and the new child growth standards. For surveys before 2006, a special data file was added with malnutrition classifications according to the new growth standards. All DHS data files contain common identification variables, which allow files to be merged for analyses. See the article, A Systematic Review of Demographic and Health Surveys, Data Availability and Utilization for Research, by Madeleine Fabrique and colleagues, published in 2012, for a detailed timeline of when biomarkers and key questions were added to the questionnaires. Data from the questionnaires are double entered into CS Pro, a free survey data software by the U.S. Census, and discrepancies are investigated and resolved in country. The final raw data set is sent to ICF International, where it is recoded with standardized variable IDs and definitions. The variable V106, for example, is highest level of education among women respondents in all DHS datasets, and the response categories are always no education, primary, secondary, and higher. As a result, DHS datasets can be easily combined across time and countries. And the Measure DHS project creates a final report of summary statistics for each DHS. The Measure DHS project is responsible for other surveys, including the Service Provision Assessment, SPA, which provides a comprehensive overview of the country's health service delivery system by interviewing healthcare providers, administrators, and patients across a sample of health facilities. They also perform malaria indicator surveys, MIS, which record data about bednet ownership and use and treatment of fever in young children. This questionnaire is often incorporated in a typical DHS, but may be administered separately. And thirdly, the AIDS Indicator Survey, AIS, which provides data to monitor national HIV/AIDS programs and outcomes. This questionnaire is usually added to a typical DHS as well. Like demographic and health surveys, these surveys are funded by USAID and implemented jointly by ICF International and the national government. DHS data are among the most widely used sources of health data in low and middle income countries. At the Measure DHS website under the Publications tab, you will find dozens of reports, working papers, and fact sheets for each survey. DHS data are also usually incorporated into a country's national statistical warehouse. In this way, DHS data are used directly by national governments to monitor health outcomes and to set national public health agendas. International organizations such as the World Health Organization and United Nations also use DHS data to generate global health statistics. And finally, individual researchers and donor agencies use this robust, extensive data set in scientific research and evaluation. There are 3 ways to access DHS data, and which approach you use will depend on your data needs and skills. The most basic DHS user cites summary statistics in the final DHS report. Users who want to tabulate statistics differently than what is available in the final report, but have limited time or skills, may use the DHS Online Stat Compiler tool. Stat Compiler is especially helpful when creating summary statistics across multiple surveys, though only a few dozen of the most common indicators are available. You might also check out Measure DHS's 5-minute video with step-by-step instructions about how to use Stat Compiler. The resources here at populationsurveyanalysis.com will help you to become an advanced DHS user. Learning how to use the DHS recode files will allow you to perform summary statistics and advanced analysis with the thousands of variables that are available in each DHS. Go to populationsurveyanalysis.com for a PDF version of this video and other learning materials that support your analysis of a population survey dataset.